Hey guys, what's going on? This is the 6th episode of I Teach, this time about LASIK. In this video, I will touch on what LASIK is really quickly, and then we will talk about who is a candidate for LASIK. LASIK is a refractive surgery where they remove tissue in the cornea, changing its shape and subsequently correcting the vision. In the case of LASIK specifically, they create a flap, they open that flap, they ablate the tissue with their laser, then they replace the flap. They do not have to use sutures because of the healing capacity of the cornea. There are a few other refractive surgeries that are available, but LASIK tends to be the most common. In order to recognize who is a good candidate for LASIK, there are a few basic guidelines that the laser clinics follow. In general, they look for patients who are 18 years or older, have a stable prescription, so that would be a change less than 0.5 diopters in the 2-year span between appointments, good overall health, and also reasonable expectations on the outcome of the surgery. Besides those basic guidelines, there are about 4 other factors that we have to consider in determining whether someone would be a good candidate. The first is just overall patient history. This would include a history of ocular diseases like keratoconus, diabetic retinopathy, severe dry eye syndrome, glaucoma, past herpes infections, progressive cataracts, to name a few. All of these represent absolute contraindications, meaning they are things that prevent people from getting LASIK. They also look at your overall systemic health. So this would include things like multiple sclerosis, Crohn's or ulcerative colitis, Accutane, or diabetes. There are other factors that they take into consideration as well, but this is just meant to be an example of a couple of things that they look at. Next, they look at keratometry, or the curvature of the cornea, that front covering of the eye. Because they're changing the shape of the cornea, the resulting curvature has to be within a certain range. The next factor to consider is pachymetry, or how thick the cornea is, that front covering again. We care about the thickness because the middle layer of the cornea, the stroma, is what the laser actually ablates, meaning that cornea gets thinner after LASIK. There is a minimum thickness of the cornea that has to be met post-surgery. Corneas over 500 microns, or half a millimeter, are usually okay for LASIK. Corneas from 460 to 500 nanometers tend to be no good for LASIK, but okay for PRK, a similar procedure. And corneas less than 460 nanometers tend to be too thin for this type of refractive surgery. The last factor that surgeons look at is the actual prescription, or refractive error. The higher the prescription, the more tissue that has to be removed, which means the riskier the procedure. For LASIK, the prescription range tends to be from +3 all the way to -10, obviously depending on the other factors discussed previous to this. And in the case of PRK, they can usually do that from 0 all the way to -9. So you'll notice they don't do the plus prescriptions with PRK. We can't just take one of these factors and tell a patient whether or not they are a candidate for LASIK. We have to take into account all of those factors to try and determine whether or not they would be someone who responds well to refractive surgery. Lots of the LASIK clinics actually do free consultations. In order to book that appointment, contact the optometrist that you normally see, and they should be able to provide you the details to set up a clinic to get that done. At that appointment, they take a couple of extra measurements just to ensure whether or not you'd be a good candidate, and give you a little bit more information about the options that you might have. That's it for today. Just a fast video, just a quick one. No nonsense, straight to the point. If you have questions about LASIK or refractive surgery or anything else, feel free to drop them below or send us a direct message. As always, thanks for watching.